Hello everyone. Today I'm going to discuss about the fractures and its classifications. So in this topic, I'm going to discuss about what is fracture, what is dislocations, what is sprain and strain, what are the different types of the fractures. So what is the classical like a classification of the fractures. So we are going to see the everything in step by step here. So and in the first topic, so is going to be about the definition of the what is fracture and also dislocations. So according to the definition, fracture is a break in the surface of the bone, either across its cortex or to the articular surface. So if any damage, any breakdown in the surface of the bone, so it is called as a fracture. So any breakage in the either cortex or at the articular surface, is there here fracture or articular surface, or is there any is the articular surface is called as fracture. So and also is different types of so many different types of fractures are is it the open fracture and closed fractures and also complete fracture and incomplete fractures. So according to the causative factors and mechanisms, the fractures will be different and also the shape will be different. So here we are going to discuss in the detail all the fractures and also coming to the definition of the dislocations. So what is dislocations? So dislocation means is the complete and also persistent displacement of the joint. It's nothing but is the separation of the joint surface here. If the two bony fragments is there, so for example, if in the shoulder, it's the glenoid cavity and also head of the humerus is going to be separated. So because of the any muscle weakness or because of the any ligament laxity. So it may be either causative factors. So next one is the subluxations. So this also that's a partial separation of the joint from the bones. There's a segment, so it is called as subluxations. So it's a partial. If you see here, this is a normal shoulder joint. So it's going to be completely attached to the glenoid cavity, but in the subluxation is going to be partially separated from the glenoid cavity. So this is called is the subluxation. So if it comes in the dislocations, is completely separated from the glenoid cavity. So that is called as dislocation. So coming to the sprain and strain. Sprain is a temporary subluxation of the joint due to the ligament injury. Is because of the ligament laxity or ligament injury. So and also and articular surface return to normal alignment. So because of this ligament laxity, so it may use the subluxation in the joint. So the ligament is going to be involved more in the sprain. Example is in ankle sprain. So if any sudden twisted of the ankle joint may use the ankle sprain. So another one is going to be the muscle strain. So we can commonly seen in the if any do any vigorous activity and also improper activities of the muscle, so may chance to get the damage, and also it will get the tear, and also maybe it will give the damage in the muscle. So which is called as strain. That is also muscle strain. Most commonly seen in the muscle. So these are the different terms we are going to see in related to the musculoskeletal injuries. So it's a fracture, dislocations, subluxation, sprain, and strain.